Okay. One thing I also want to mention, the reasoning for the hand placement is because, to allow the patient to maintain their balance. Because what can happen, a lot of patients want to grab onto the walker with both hands when they're seated, and I'll actually kind of demonstrate this. But what can happen is if they want to grab onto the walker and they try to stand up, they can come back on them and they can lose their balance backwards. So that's why we don't have them put both their hands on the walker. You always at least want one hand on the sitting surface. All right. One thing I also want to mention, for the most part it's the same, but occasionally with your hip nailings, your ORIF, if they put a rod in the hip, occasionally there are some weight bearing restrictions. It could be anything from non-weight bearing, which is not putting any weight through the surgical extremity at all, or it could be partial weight bearing. Now, partial weight bearing, basically what that means is, sometimes the physician gives you a percentage of the patient's body weight that they want to, try to focus on. So, for example, some surgeons will say 25% of their body weight through that extremity. If they don't specify, the general rule of thumb is to do 50%. I'll talk about that a little bit later when we get into the walking, but right now I want to demonstrate non-weight bearing, which doesn't happen very often, but you will see it occasionally. So let's say Melinda here, she had a right hip nailing, and she is to be non-weight bearing. So what you really want to do, and this is going to be difficult for the patient, so you probably want to get another person for this because they really only have one good leg to stand on. So it's the same way as if you were standing them regularly. The only difference is they're going to want to try to hold up that right leg when they go to stand. They may not be able to do that. So one thing you can do is you can actually put your foot underneath their foot, and that way it kind of gives them tactile cues not to put weight down through it. All right, so I'm going to actually do that here. I'm going to put my foot right there, and then what I'm going to have Melinda do, I'm going to have her put one hand on the bed again and one hand on the walker, and again I'm going to count to 3, and on 3 we're going to stand, and I'm going to encourage Melinda not to put weight down on the right leg. So she's basically going to be standing with her arms and her left leg. So we'll demonstrate that now. All right, on the count of 3 here, Melinda, we're gonna stand up here. If you can, try not to put any weight down on that right leg. Just try to use your arms and your left leg.
Okay.
All right, 1, 2, and 3. That's it. Okay.